Might those pimples on your skin be due to a fungus? This is a question that I get all the time in the office working as a board-certified dermatologist and acne expert. In this video, I want to help break down how do we tell apart regular run-of-the-mill acne from fungal acne, which is also known as Pityrosporum or Malessezia folliculitis. To start, let's just review routine run-of-the-mill acne. This is caused by when our oil glands in our skin, the sebaceous gland, they're making too much oil, that's clogging up our pores, and that's food for acne bacteria. These oil glands are turned on by hormones. This is why acne often starts in puberty, and while really all acne is hormonal. However, we also have a fungus on our skin, just a normal organism that's part of our microbiome, our normal bacteria on the skin. And it goes by the name of Pityrosporum or Malessezia. Now this fungus, it also likes oil, and we've got a lot of oil glands on our face. So sometimes this fungus can start to overgrow, and it can start to get into the follicles, and it can cause pimple bumps. Now when we get pimple bumps from this fungus, from Malessezia, from Pityrosporum, these pimple bumps, they tend to be small, they tend to all look the same, that's also sometimes known as being monomorphic, and they also tend to be itchy. So these are some key features that can help us tell this apart from regular run-of-the-mill acne. So to summarize, the key way to tell apart is this routine run-of-the-mill acne or is it Pityrosporum folliculitis is if you're seeing lots of small, monomorphic, similarly sized bumps that are kind of white to pink. If they're itchy, those are signs that this is more likely to be Pityrosporum folliculitis. If you're seeing a range of different kinds of bumps that include whiteheads, blackheads, papules and pustules, and maybe even some larger nodules and cysts, and that might be painful, that's going to suggest that this is due to acne. Now when it comes to treatment of Pityrosporum folliculitis, of fungal acne, what can we do? Well, if we know that it's caused by this yeast, by Pityrosporum, we're going to want to use treatment strategies that are directed at yeast. And this is why a lot of our classic acne treatments, like antibiotics, like topical retinoids or retinols, like benzoyl peroxide, might not be so helpful here, because those are more directed at acne bacteria. They're not really going to address these kinds of yeast that are driving Pityrosporum folliculitis. Instead, we want to use treatments like antifungal creams or washes, like ketoconazole. We could think actually about like anti-dandruff products that have anti-yeast activity. So anti-dandruff soaps or shampoos, things that have pyrithyron zinc in them, things that have selenium sulfide or sulfur in them, those can be helpful for Pityrosporum folliculitis. In addition, I mentioned that oil, that's the food for this yeast. So things that can help reduce the oiliness of our skin, like salicylic acid washes or toners, those can also be helpful when it comes to treating Pityrosporum folliculitis. Now, as we mentioned earlier, some people are going to have both Pityrosporum folliculitis and acne, and they're going to need treatments that address the whole picture. If you treat just acne, that Pityrosporum folliculitis might be sticking around. If you treat just the Pityrosporum folliculitis, that acne might be sitting around. So if you're someone who notices that you have a lot of these crops of these itchy, monomorphic, similar sized bumps, but there's also comedones, papules, pustules, that there's aspects of both of them, it's going to be important to develop a comprehensive treatment strategy that can address not just the Pityrosporum folliculitis, but the acne as well. And here, of course, things like salicylic acid make a lot of sense because they're going to be a 2-in-1. They're going to help with oiliness, that's a key part of acne, and with Pityrosporum folliculitis. But we might also need to add some other treatments for Pityrosporum and some other treatments for acne as well. Now we've got a whole bunch of videos on the channel about how to treat acne, so check those out if you're interested in learning more about how to address acne. So to summarize, if you're seeing lots of similarly sized, we call it monomorphic, pink to red bumps on the skin that might be itchy, or if you have pimples that just aren't getting better with standard acne treatments, it's worth thinking about whether that might reflect Pityrosporum folliculitis or fungal acne. And to treat that, we're going to need to use approaches that address yeast, that address Pityrosporum and Malessezia, rather than our standard acne kinds of treatments. So we're going to want to think about things like salicylic acid, like pyrithyron zinc, or selenium sulfide, or sulfur, or antifungal treatments, either over-the-counter or prescription options. I hope you found this video helpful. If you have, please give it a like and consider subscribing to the channel so we can share it with more in the community. In addition, ask me your questions about acne in the comments below. Until next time, see ya!